Hey cousins, welcome to Brown Liquor and Bad Ideas.
Welcome, cousins, to this episode of Brown Liquor and Bad Ideas. I'm your host, Cornell Wright, the People's Lobbyist, and let's talk about COVID-19, Omicron. Brown Liquor and Bad Ideas is intended for the participation of responsible adults of legal drinking age who wish to engage in substantive virtual discussions and social drinking for entertainment purposes only. Brown Liquor and Bad Ideas does not advocate the abuse of alcoholic beverages. Choosing to participate in any of the drinking activities shared in the program should be made with moderation and caution and is the sole responsibility of the user. So cousins, continue wearing your masks because we need to. And we know that masks tend to reduce the impact of respiratory-borne diseases like the normal flu that we occur, and of course, this continuation of COVID. We need one, cousins. So, cousins, I know we've talked about this a lot on this program, and the reason we do is because we need to care about each other, because it's difficult for us to have us in regards to we the people when we're having a disease that is impacting and still taking away 1,000 cousins a day across the country. Think about that, 1,000 cousins a day. Now, we don't hear about it until there's a surge. We don't hear about it until you have somebody in your family or your community hospital system starts to get overwhelmed as the disease in its various forms moves around the country. I had a friend of mine recently come back and said, well, based upon where he had traveled, COVID-19 and or its variants didn't exist. Well, that's true. But if you go on the CDC website and you see the description at the bottom of this episode, you'll see that it moves around the country, from one segment to the country to another segment. So the Northeast may be getting more outbreaks and the Southeast may be a little more quiet as it continues to move around the country, in which a pattern that I don't quite understand and maybe we haven't quite figured out yet. But so cousins, we think about this whole thing and we're talking about getting vaccines and with now the booster shot. So just a quick review, cousins, about this, and let's just think about it. I'm not a scientist, I'm a lobbyist, a people's lobbyist, right? So I just try to read and try to understand and bring you the best information I can as accurately as I can so you can make the best decisions for you that you can. But if we go back, set the clock back just a little bit, COVID-19, the original COVID that we heard about, came in late 2019, and we now know the President of the United States knew about it in January of 2020, right? And so we all went through the whole year of 2020, the lockdowns and all this kind of stuff because we didn't know. The warp speed was put in place in order to try to get the vaccines available to us. The testing wasn't available. PPE supplies weren't available, that sort of thing. Those things got resolved. And now we're in a pretty good place in regards to both vaccines, PPEs, and testing, right? Due in large part to the Trump administration and the Biden administration, and a lot of cooperation on a lot of cousins across the country, right? But you think about it, cousins. So, we've all watched the movies and all seen the sci-fi things about viruses and zombies and that sort of things. But cousins, you think about this. We heard about COVID-19 in late 2019, early 2020. Then the variant of Delta came out in July timeframe of 2021, this year. So I don't know about you, cousins, but I have a little bit of understanding about, the nature of things and evolution and those kind of things and how things evolved to try to survive in the environment. Well, the president told us, President Trump told us that the virus was going to go away sometime. No, the virus rests in us. It's not going away. It just has to be suppressed and fought by us. You with me, cousins? The COVID-19 and all the variants only exist in human bodies. And it's human bodies that transmits this to one another, as you all know, through respiratory droplets. Coughing, sneezing, normal exhaling, those kind of things, right? That's what happens. It's respiratory. It comes into your lungs. from your lungs that then infects and takes care of whatever else happens in your body. So think about this, cousin. We now had the variant of Delta, and I don't know if you've heard, couldn't miss it over the last couple of weeks, stock market even had an impact on it. We had the Omicron, I'm going to pronounce this correctly, the Omicron variant. Okay, now we said it was South Africa, but when you really go back and look at it, South Africa is where it was determined by their medical and healthcare people in order to make that determination, but it actually originated where? In the Netherlands. So think about that, cousins. There's a relationship between South Africa and the Netherlands. Do your South African history, South Africa, and you understand that connection. So that's where it started. All right? So now we have this new variant that's coming around of significance. There have been other variants that haven't been quite as significant, hasn't got as much of a foothold in our human race, in our humanity, but you can be sure that more are coming. So cousins, I know, you may have checked out one of my last episodes a couple months ago, and I said, if we could just get a handle on this thing, which is what we were trying to get with suppressing and being in place, trying to get a handle on suppressing it and taking the vaccines quickly, which is now taking much too long in my estimation for what would have been a normal society in order to try to suppress and fight a war against a system or against a disease that was killing millions of cousins around the world and over 700,000 cousins in the United States. Okay? I mean, and by the way, this is getting everybody and every demographic. I don't care who you are, what state you live in, tall, short, you know the story, cousins. This is getting us all. So, you think about this whole thing, cousins, it kind of says, well, what are we going to do? Well, it's going to continue to evolve unless we continue to work at suppressing it. That's why I keep wearing my mask and hope that you do too. Not because I haven't been vaccinated, I have, but because I don't want to give the opportunity of me being a carrier, I don't know if that's possible if I've been vaccinated, but we don't know for sure, in regards to me passing it on to a cousin who hasn't been vaccinated. Because if you heard, a lot of the cousins who were in the hospital and were dying as a result of COVID-19, most recently were those who didn't have the vaccine because the Delta variant was the one that was most prevalent in the United States. Think about that, cousins. They didn't get the vaccine that was available for free, and then they died. I'm sorry, cousins. But so let's make sense out of this. This is no longer political. It never was. It is public health, not only in the United States, but I would say it's a question of humanity health around the world because it's global. So unfortunately, President Biden put a travel ban on southern African continent when in fact it originated in the Netherlands and they're still coming back and forth. So there's another question that's going to have to be addressed there, right? Okay, but pretty soon it's going to start being, and countries are going to start putting up the walls again as to who can come in and who can't because of another variant. And so do we want to continue living with this or we want to try to fix this? I'm not comfortable with continuing living with it. I'm sure you're not either. And always questioning what cousin is around you, who's doing what, who's been vaccinated, who hasn't, staying within your bubble. Hey, cousins, we could do better than this, can't we? So here's something that's happening, and it's going to happen is my anticipation. In Singapore, right now, the government will not pay for your health expenses if you get COVID-19 and didn't receive the vaccine for free. Ooh, cousins. Okay, think about that. All right? Here's the bad idea. I don't really mean this, but I kind of sort of do. In the United States, we've had all sorts of reasons to suppress voting for all sorts of people, most notably black cousins. And so one was a poll tax, there was a literacy tax, there was all sorts of other things that people used to suppress black vote over time in the United States. So suppose we now have, if you don't have your COVID vaccination card, you can't vote. What do you think about that one, cousins? Because I could make a case that if you don't care about the rest of us in regards to your community to get the vaccine so we're not spreading this disease that's taking out every cousin, maybe you shouldn't vote. All right, cousins, I'm teasing about that, but that is a bad idea, and there's a lot of other bad ideas out there, so you can throw it on that pile. So we now look at it, and I have a friend I saw during Thanksgiving. This kind of makes some more sense to her, right? And she is a young woman in her 40s, young in my opinion. She had COVID-19. And as a result of COVID-19, she told me that while she was sick, she couldn't climb 6 steps in order to get into her home. 6. At this point in time, and that was back in, beginning of the year, she's still having some respiratory issues. She still has not gotten back all of her taste sensitivities. And as a result, for those of you understanding sushi or know what wasabi is, she can take a teaspoon of wasabi and eat a teaspoon of wasabi. Now, I don't know about you, but I enjoy wasabi in my sushi, but I'm doing little small pieces, not like a teaspoonful. You see what I'm saying, cousins? Which says that lends to the long-term implications of what COVID-19 is having on her body. They're talking about other cousins who are having longer-term implications on the damage that's been done, most notably the lungs and other parts of the body. So cousins, here's what's going to come to you. You watch this, and you tell me if I'm not true. The insurance companies are going to start to figure this out in regards to understanding the true health impacts of what COVID-19 has been, not only for those who have it actively, but for those who have recovered from it and have long-term implications. So there might be a day in the not too distant future where you're going to have to check off a box, have you ever had COVID-19? And your insurance cost is going to go up, I bet you. You will also start to see for all the cousins out there and various companies who are still fortunate enough to have company-sponsored health care, that pretty soon there's going to be a question of how many members of your workforce are fully vaccinated and how many aren't. And based upon those numbers, there's going to be a higher medical coverage for those cousins who aren't covered. I know a lot of you cousins out there are pretty much staunch regarding, hey, I don't want to pay for something that people made decisions upon their own, et cetera, et cetera, et cetera. You know how that conversation goes, cousins. Well, so here's one for you. For all those cousins who didn't get the vaccine and all the medical costs that they're incurring, who should pay for that? Now, cousins, I'm a compassionate person. I'm for all of us. I hope you understand. But at some point in time, we start asking these questions, and it starts to say, You with me, cousins? So look, it's here. We know the impacts now. We can't be fooled anymore about somebody making a political position or somebody making a pseudoscience position or someone not caring about cousins. We have met the enemy, and it's us. We're fortunate enough to live in the United States where we have enough PPE equipment, we have enough testing capabilities, we have enough vaccines. Let's go get them and let's start doing what's right. Because here's the terrible question, cousins. When I got my original COVID vaccine, and I got 2, I got my card laminated. I got my card laminated because I believe that, one, it was kind of nice. It was a historic moment, occurrence, like you get your baseball cards laminated. Secondly, I assumed that I was going to have to show my card, which is also true, in a number of different locations. So when I went and got my booster shot, I got another card. And so the woman at the desk who was helping me at the pharmacy, she said, don't get this one laminated. I said, why not? She said, because you might have to get another booster shot and we can just add this one to it. Cousins, come on. That means that some people are anticipating we're going to have to continue working with this unless what? Unless we decide, we the people, decide that we want to fix it and do what's right in order to suppress this COVID-19 plague that's been impacting not only us nationally, but the whole planet. It's a humanity question at this point, cousins. Let's take care of our own humanity, get the vaccine, take care of each other. All right? So we'll see you next week on next episode of Brown Liquor and Bad Ideas. Take care of yourself.
We are the people. Welcome to the show.